1. A nurse assesses a client with chest pain who is pale and diaphoretic. What should the nurse do first? A. Obtain a complete history. B. Administer nitroglycerin as ordered. C. Assess airway and vital signs. D. Notify the physician. Answer: C. Assess airway and vital signs. Rationale: always ensure airway and hemodynamic stability before interventions or calling the provider. Strategy: many fail by calling the physician first. Apply ABCs, airway, breathing, circulation, every time. 2. A client receiving digoxin complains of nausea and blurred vision. The nurse's priority action is to A. Document and monitor. B. Give antiemetic. C. Hold digoxin and check heart rate. D. Notify family. Answer: C. Hold digoxin and check heart rate. Rationale: symptoms indicate possible digoxin toxicity. Strategy: don't rush to document or notify, first assess safety and confirm findings. 3. A postpartum client reports a severe headache after spinal anesthesia. The nurse should A. Encourage fluids and caffeine. B. Apply cold compress. C. Administer morphine 4. D. Reposition side lying. Answer: A. Encourage fluids and caffeine. Rationale: postdural puncture headache improves with hydration and caffeine intake. Strategy: don't jump to narcotics, Nclex expects non-invasive comfort first. 4. A child with asthma presents with wheezing that suddenly stops and appears lethargic. What is the best action? A. Continue monitoring. B. Administer prescribed bronchodilator. C. Call the provider immediately. D. Reassure the parents. Answer: C. Call the provider immediately. Rationale: disappearance of wheeze may indicate airway obstruction or impending respiratory arrest. Strategy: never mistake quiet chest as improvement, it's a red flag. 5. A nurse prepares to administer potassium chloride 4. What must the nurse check first? A. Blood pressure. B. Urine output. C. Serum calcium. D. Bowel movement. Answer: B. Urine output. Rationale: potassium is contraindicated if urine output is less than 30 milliliters per hour, risk of hyperkalemia. Strategy: always check renal function before K+ administration. 6. A nurse notes a postpartum woman with a firm uterus but heavy bleeding. What's the next action? A. Massage the uterus. B. Call for help, suspect laceration. C. Give oxytocin. D. Monitor further. Answer: B. Call for help, suspect laceration. Rationale: firm uterus plus bleeding equals possible vaginal/cervical tear. Strategy: Nclex tests your ability to differentiate uterine atony versus laceration. 7. A client receiving morphine develops respiratory rate 8 per minute. What should the nurse do first? A. Administer naloxone. B. Check oxygen saturation. C. Stimulate the patient. D. Notify provider. Answer: C. Stimulate the patient. Rationale: light stimulation may restore breathing, if no response, then administer naloxone. Strategy: Nclex often tests sequence of response, assess first, then act. 8. A client with diabetes is scheduled for surgery. The morning glucose is 58 mg per deciliter. The nurse should A. Proceed with surgery. B. Administer insulin as usual. C. Hold insulin and notify provider. D. Give D5-4 push. Answer: C. Hold insulin and notify provider. Rationale: hypoglycemia before surgery is dangerous. The provider may adjust insulin dose or delay surgery. Strategy: always validate abnormal results before interventions. 9. An elderly client on diuretics reports muscle weakness. The nurse reviews lab results showing potassium 2.9 milliequivalent/L. What's the next step? A. Increase oral fluids. B. Stop diuretic and notify provider. C. Continue medication as ordered. D. Restrict sodium. Answer: B. Stop diuretic and notify provider. Rationale: hypokalemia increases risk of dysrhythmia. The provider must adjust medication. Strategy: don't independently adjust dose, recognize and report abnormal labs. 10. A nurse cares for a client with Addison's disease showing confusion, low BP, and weak pulse. Which intervention is priority? A. Provide comfort. B. Administer 4-hydrocortisone. C. Encourage oral fluids. D. Place in Trendelenburg position. Answer: B. Administer 4-hydrocortisone. Rationale: symptoms indicate Addisonian crisis requiring steroid replacement. Strategy: when in shock-like state plus adrenal history equals think steroids, not fluids first. Question 11. A nurse is caring for a patient with COPD who receives oxygen at 4 liters per minute via nasal cannula. The patient becomes drowsy with a respiratory rate of 10 per minute. What should the nurse do first? A. Reduce oxygen flow to 2 liters per minute. B. Increase oxygen to 6 liters per minute. C. Call the provider. D. Check oxygen saturation. Answer: A. Reduce oxygen flow to 2 liters per minute. Rationale: high oxygen flow in COPD can suppress the hypoxic drive. Strategy: avoid the Nclex trap of always increase oxygen. COPD patients need low-flow oxygen. Question 12. A client with pneumonia suddenly becomes restless and agitated. The nurse's first action should be: A. Administer sedatives. B. Assess oxygen saturation. C. Call the provider. D. Check temperature. Answer: B. Assess oxygen saturation. Rationale: restlessness and agitation often indicate hypoxia. Strategy: before acting, always assess oxygenation, classic Nclex priority concept. Question 13. A nurse is caring for a burn patient with urine output of 15 milliliters per hour. What is the most appropriate action? A. Increase oral fluids. B. Continue monitoring. C. Notify provider immediately. D. Measure abdominal girth. Answer: C. Notify provider immediately. Rationale: urine output less than 30 milliliters per hour in burns may indicate renal hypoperfusion or shock. Strategy: always connect low urine output to perfusion problem in Nclex. Question 14. A nurse is caring for a patient receiving 4 heparin. The APTT is 120 seconds. The next action is: A. Continue infusion. B. Stop infusion and notify provider. C. Give vitamin K. D. Administer heparin bolus. Answer: B. Stop infusion and notify provider. Rationale: therapeutic APTT is 60 to 80 seconds, 120 is too high, risk of bleeding. Strategy: always link lab value safety response provider notification. Question 15. A client after thyroidectomy suddenly develops hoarseness and difficulty breathing. The nurse should: A. Encourage coughing. B. Place the client in high Fowler's position. C. Administer a sedative. D. Offer water. Answer: B. Place the client in high Fowler's position. Rationale: airway obstruction from edema or hematoma is a life-threatening emergency. Strategy: never delay, airway first. Question 16. A nurse prepares to give morning insulin to a diabetic patient who has not eaten. What is the best action? A. Give insulin as ordered. B. Give insulin and encourage meal. C. Hold insulin and notify provider. D. Give half the dose. Answer: C. Hold insulin and notify provider. Rationale: giving insulin without food may cause hypoglycemia. Strategy: always check meal status before insulin administration. Question 17. A client receiving a blood transfusion reports back pain and chills. What should the nurse do first? A. Slow the transfusion rate. B. Stop the transfusion immediately. C. Give acetaminophen. D. Notify the provider after transfusion ends. Answer: B. Stop the transfusion immediately. Rationale: symptoms indicate hemolytic reaction. Strategy: remember, stop, maintain 4 with saline, then call provider. Question 18. A nurse notices a chest tube has accidentally dislodged from the client. The immediate action is: A. Cover with a sterile dry dressing. B. Cover with sterile petroleum gauze. C. Reinsert the tube. D. Leave it open to air. Answer: B. Cover with sterile petroleum gauze. Rationale: prevents air entry and tension pneumothorax. Strategy: don't try to reinsert, focus on sealing the chest wound. Question 19. A nurse receives a patient with a sodium level of 122 milliequivalent/L. The nurse should monitor for: A. Hypertension. B. Seizures. C. Constipation. D. Bradycardia. Answer: B. Seizures. Rationale: hyponatremia causes cerebral edema leading to seizure risk. Strategy: always link electrolyte imbalance body system most affected. Question 20. A patient after abdominal surgery reports shortness of breath and chest pain. The nurse suspects pulmonary embolism. What should be done first? A. Encourage coughing. B. Notify provider immediately. C. Place client on bed rest with head elevated. D. Assess pedal pulses. Answer: C. Place client on bed rest with head elevated. Rationale: supports oxygenation and prevents clot migration. Strategy: act quickly for P equals position plus O2 plus notify. Question 21. A client with a tracheostomy suddenly cannot breathe, and the tube is dislodged. The nurse should: A. Call respiratory therapy. B. Insert obturator to replace the tube. C. Use a manual resuscitation bag over the stoma. D. Cover stoma and call provider. Answer: C. Use a manual resuscitation bag over the stoma. Rationale: ensures oxygenation until airway is re-established. Question 22. A nurse is caring for a patient with newly prescribed warfarin. Which lab result requires immediate attention? A. 2.5 Indian rupees. B. 5 Indian rupees. C. PT 14 seconds. D. 1.2 Indian rupees. Answer: B. 5 Indian rupees. Rationale: increased INR indicates risk for bleeding. Strategy: memorize critical lab values and act fast for safety. Question 23. A psychiatric patient reports hearing voices commanding harm to others. The nurse should: A. Explore feelings about the voices. B. Set firm limits and ensure safety. C. Ignore the comment. D. Ask what the voices are saying. Answer: B. Set firm limits and ensure safety. Rationale: command hallucinations pose safety threat. Strategy: always prioritize safety over assessment when danger exists. Question 24. A nurse caring for a patient on furosemide notes muscle cramps and irregular pulse. The nurse expects which lab result? A. Sodium 148 milliequivalent/L. B. Potassium 2.8 milliequivalent/L. C. Calcium 11 mg per deciliter. D. Magnesium 2.4 mg per deciliter. Answer: B. Potassium 2.8 milliequivalent/L. Rationale: loop diuretics cause hypokalemia, leading to dysrhythmias. Strategy: connect symptoms to expected drug effects. Question 25. A nurse notes a client's foresight is red and swollen. The next step is: A. Slow the infusion rate. B. Remove the fore and apply warm compress. C. Notify the provider. D. Elevate the arm and continue infusion. Answer: B. Remove the fore and apply warm compress. Rationale: indicates phlebitis. Strategy: don't just slow, stop, remove, and treat. Question 26. A patient on mechanical ventilation suddenly has low pressure alarm. The nurse should: A. Check for tubing disconnection. B. Suction airway. C. Increase ventilator rate. D. Silence alarm and monitor. Answer: A. Check for tubing disconnection. Rationale: low pressure alarms equals disconnection or leak. Strategy: know the meaning of ventilator alarms. Question 27. A nurse finds a post-op patient pale and cold with a rigid abdomen. The priority action is: A. Check drainage output. B. Notify provider, suspect internal bleeding. C. Encourage deep breathing. D. Offer warm blanket. Answer: B. Notify provider, suspect internal bleeding. Rationale: signs indicate possible hemorrhage. Strategy: always act on life-threatening findings immediately. Question 28. A patient receiving TPN develops shortness of breath and chest pain during infusion. The nurse should: A. Check for kinks in tubing. B. Stop TPN and place client on left side with head down. C. Flush the line with saline. D. Decrease infusion rate. Answer: B. Stop TPN and place client on left side with head down. Rationale: maybe air embolism. Left side Trendelenburg traps air. Strategy: position plus oxygen plus call provider equals air embolism protocol. Question 29. A nurse caring for a patient with DKA expects which finding? A. Low blood sugar. B. Kussmaul respirations. C. bradypnea. D. Low urine output. Answer: B. Kussmaul respirations. Rationale: deep rapid breathing compensates for metabolic acidosis. Strategy: associate breathing patterns with acid-base disorders. Question 30. A client on chemotherapy reports mouth ulcers and bleeding gums. The nurse suspects: A. Neutropenia. B. Thrombocytopenia. C. Leukocytosis. D. Anemia. Answer: B. Thrombocytopenia. Rationale: low platelet count causes bleeding. Strategy: recognize lab-linked symptoms instead of memorizing isolated facts. Question 31. A patient with heart failure reports a sudden weight gain of 5 pounds in 2 days. What is the nurse's best action? A. Restrict fluid and notify the provider. B. Reassure the patient this is normal. C. Increase daily exercise. D. Document and recheck weight tomorrow. Answer: A. Restrict fluid and notify the provider. Rationale: sudden weight gain indicates fluid retention and worsening heart failure. Strategy: always connect sudden weight gain to fluid overload danger. Question 32. A nurse caring for a neutropenic patient observes a visitor bringing fresh flowers. What should the nurse do? A. Allow the flowers but remove later. B. Educate visitor about infection risk and remove flowers. C. Place flowers on bedside table. D. Spray flowers with disinfectant. Answer: B. Educate visitor about infection risk and remove flowers. Rationale: fresh plants harbor bacteria/fungi that threaten immunocompromised patients. Strategy: infection control equals prevention before comfort. Question 33. A nurse observes a patient's urine output drop to 10 milliliters per hour postoperatively. What is the first action? A. Call the provider immediately. B. Check for kinked or blocked catheter. C. Increase 4 fluids. D. Reassess in 1 hour. Answer: B. Check for kinked or blocked catheter. Rationale: always assess the equipment first before calling the provider. Strategy: NCLEX rule, assess before act unless emergency. Question 34. A client with cirrhosis develops confusion and a musty breath odor. Which lab result supports the nurse's suspicion? A. Low potassium. B. High ammonia. C. High bilirubin. D. Low albumin. Answer: B. High ammonia. Rationale: increased ammonia causes hepatic encephalopathy. Strategy: focus on pathophysiology clues, odor, confusion equals ammonia. Question 35. A client receiving 4 vancomycin complains of itching and facial flushing. What is the next action? A. Stop infusion and notify provider. B. Continue and document findings. C. Give diphenhydramine 4 push. D. Lower head of bed. Answer: A. Stop infusion and notify provider. Rationale: symptoms indicate red man syndrome and infusion reaction. Strategy: never assume mild, always stop drug causing adverse effects. Question 36. A patient with spinal cord injury reports pounding headache and flushed face. BP is 210/110 mmHg. What should the nurse do first? A. Administer pain medication. B. Place patient in high Fowler's position. C. Increase 4 fluids. D. Notify provider after 15 minutes. Answer: B. Place patient in high Fowler's position. Rationale: autonomic dysreflexia, raise HOB immediately to lower BP. Strategy: remember, position first to prevent stroke. Question 37. A client with diabetic neuropathy has a foot ulcer. Which nursing action is most important? A. Apply warm compress. B. Assess feet daily. C. Soak feet in hot water. D. Use alcohol on wounds. Answer: B. Assess feet daily. Rationale: daily foot inspection prevents infection and amputation. Strategy: NCLEX favors prevention and assessment over treatment. Question 38. A patient with a chest tube has continuous bubbling in the water seal chamber. The nurse should: A. Document as normal. B. Check for air leak. C. Add more water to the chamber. D. Clamp the tube. Answer: B. Check for air leak. Rationale: continuous bubbling equals air leak, should be intermittent. Strategy: identify what's expected versus abnormal equipment finding. Question 39. A nurse is preparing to administer enteral feeding to a comatose patient. The first step is: A. Flush the tube with water. B. Check residual volume. C. Verify tube placement. D. Position patient flat. Answer: C. Verify tube placement. Rationale: prevents aspiration due to tube misplacement. Strategy: Always verify first before administering anything enterally. Question 40. A patient with pancreatitis has severe epigastric pain radiating to the back. The nurse should A. Place in high Fowler's position. B. Place in side-lying position with knees flexed. C. Encourage ambulation. D. Offer cold compress to abdomen. Answer: B. Place in side-lying position with knees flexed. Rationale: flexed position relieves abdominal tension and pain. Strategy: no comfort positions for common conditions. Question 41. A patient on total parenteral nutrition, TPN, reports feeling shaky and sweaty. The nurse checks glucose, 50 mg per deciliter. What should be done first? A. Stop TPN. B. Administer 50% dextrose 4. C. Call the provider. D. Recheck glucose in 30 minutes. Answer: B. Administer 50% dextrose 4. Rationale: immediate treatment for hypoglycemia. Strategy: critical low glucose equals treat before call. Question 42. A nurse gives an IM injection and the patient develops hives and shortness of breath. What is the first action? A. Stop injection and call provider. B. Administer epinephrine IM. C. Start oxygen at 2 liters per minute. D. Prepare 4 fluids. Answer: B. Administer epinephrine IM. Rationale: first-line treatment for anaphylaxis. Strategy: no first drug to give in emergencies. Question 43. A client with tuberculosis is placed on airborne precautions. Which PPE is most essential? A. Surgical mask. B. N95 respirator. C. Face shield. D. Sterile gloves. Answer: B. N95 respirator. Rationale: N95 prevents inhalation of airborne TB droplets. Strategy: match disease isolation type PPE. Question 44. A nurse finds a patient with diabetes unconscious and diaphoretic. What is the first action? A. Administer glucagon IM. B. Start 4 insulin. C. Place in Trendelenburg. D. Call for blood glucose test. Answer: A. Administer glucagon IM. Rationale: classic hypoglycemia emergency. Strategy: when in doubt, treat low sugar immediately. Question 45. A client receiving chemotherapy has WBC count 1000/mm superscript 3. The most important instruction is: A. Avoid large crowds and sick people. B. Drink 3 L of water daily. C. Report fatigue. D. Eat high-fiber foods. Answer: A. Avoid large crowds and sick people. Rationale: severe neutropenia equals infection risk. Strategy: think precautions before nutrition or comfort. Question 46. A nurse observes a patient having a tonic-clonic seizure. The most important action is: A. Restrain the patient's movements. B. Place padded side rails and turn head to side. C. Insert tongue blade. D. Hold patient's arm still. Answer: B. Place padded side rails and turn head to side. Rationale: prevents injury and aspiration. Strategy: NCLEX tests seizure safety actions, not treatments. Question 47. A client with schizophrenia says, "The TV is sending me messages." What is the best nursing response? A. That's not true. B. Tell me more about what you hear. C. You must ignore those messages. D. Why do you think that? Answer: B. Tell me more about what you hear. Rationale: encourages therapeutic communication and assessment. Strategy: avoid arguing reality, use validation plus exploration. Question 48. A patient with C. difficile infection is on contact precautions. Which action shows correct understanding? A. Use hand sanitizer after care. B. Wash hands with soap and water. C. Remove gown before leaving room. D. Wear N95 mask. Answer: B. Wash hands with soap and water. Rationale: alcohol does not kill C. difficile spores. Strategy: remember exceptions, C. diff equals soap and water. Question 49. A nurse finds a client on suicide watch giving away belongings. The next step is: A. Document the observation. B. Notify provider and maintain close supervision. C. Reassure the client. D. Ask why they are doing it. Answer: B. Notify provider and maintain close supervision. Rationale: giving away possessions equals suicidal intent. Strategy: always treat behavioral red flags as emergencies. Question 50. A postoperative patient receiving opioids reports constipation for 3 days. The nurse should A. Increase fluid and fiber intake. B. Encourage walking and mobility. C. Administer stool softener as prescribed. D. Call the provider immediately. Answer: C. Administer stool softener as prescribed. Rationale: opioid-induced constipation is expected and preventable. Strategy: Nclex expects you to know common side effects and nursing actions. Congratulations! You've mastered 50 clinical Nclex questions designed to eliminate the most common test mistakes. Remember, success isn't just about memorizing, it's about thinking like a nurse. Keep practicing clinical reasoning, manage your time, and approach each question calmly. You're not just preparing for an exam, you're preparing FO.